Good evening, I'm Hunter Kelly. This is Up to Date. Normally I like to start the program giving you the numbers and latest information regarding the coronavirus itself. However, an important development came to light this week. The President and Vice President initially announced on Monday the coronavirus task force would be phased out by Memorial Day, which is 17 days from today. The task force has been the driving force behind the strong mitigation strategies we've seen across the country throughout the last few months, including publicly encouraging social distancing, wearing masks when being out in public, and informing the American people at daily press briefings. And as numbers continue to rise, reaching over 76,000 cases as of Thursday night, the president originally announced he thought it would be best to begin phasing out the task force.
Mike Pence and the task force have done a great job, but we're now looking at a little bit of a different form, and that form is safety and opening, and we'll have a different group probably set up for that.
Now, the task force hasn't held a task force briefing in days, and according to reports, also hasn't held meetings among themselves in days either, as the head of the task force, Vice President Mike Pence, has been on the road visiting the Mayo Clinic in Rochester, Minnesota last week, and visiting Des Moines, Iowa today. But the president reversed course on Wednesday, saying the task force would stay together, citing cases getting worse in the country and admitting the amount of deaths are worse than those of 9/11 and Pearl Harbor.
Actually, yesterday, when I started talking about winding it down, I'd get calls from very respected people saying, I think it would be better to keep it going. It's done such a good job. It's a respected task force.
Trump's own administration also created internal projection models this week, which predicts a jump in cases per day and deaths per day by the end of the month. And the country is slowly beginning to reopen, but we're still not sure how those numbers look relative to the new openings around the country. Also, an ousted vaccine director has filed a whistleblower's complaint alleging he was wrongly removed from his position when he decided to not direct funding for a certain medication. We'll discuss all of these recent developments right now. Some states have begun reopening parks and beaches to the public. From Newport Beach, California to the National Mall in Washington, D.C., the warmer weather is beginning to bring out crowds to enjoy it. But many aren't practicing social distancing or wearing protective face masks. White House coronavirus coordinator Dr. Deborah Birx says these openings are okay as long as people are social distancing.
It's not done with social distancing, no.
Those aren't the only people getting out of the house. Protesters last week in Michigan stormed the state building, some with assault rifles in hand. The worst part, the lack of physical distancing and masks.
We need to protect each other at the same time we're voicing our discontent.
Later, we'll discuss how a new internal White House report may show that faster reopenings may be more hurtful than helpful. Small business owners and employees around the country have been struggling to stay afloat. I report on the challenges facing two local small business workers in PA. Some businesses across the country have begun reopening, and 24 counties in PA will start to reopen May 8th, but those plans don't include hair salons, barbershops, or gyms. And without an end in sight, a stylist from Mamzelle Hair Salon in Levittown, PA, says it's weird for someone in her profession to sit around all day without having the opportunity to work.
It's just the way we go. We are constantly thinking of new ideas and moving and going. It's very rare you'll find like a successful hairstylist that is okay with just sitting.
Jessica Diaz says she filed for unemployment as soon as possible, but the money she collects doesn't compare to the money she would make at her salon.
It's definitely not more than what we make in the salon.
And Diaz says she's still not exactly sure how it works, stating that the payments bi-weekly aren't consistent.
Where sometimes I log in and I'm like, whoa, that's a big chunk. And other times I log in and I'm like, ooh, what happened this week?
The $660 billion Small Business Rescue Program has also faced many technical errors and misdirected funds, leaving one private gym owner in PA with no way to pay for the gym's expenses without customers.
The one said that our application has been accepted and we'll hear from a representative or somebody that will reach out to us, that basically we don't have to keep reaching out. When they get a representative, they'll turn it over and then we'll get an email. And I've yet to receive anything.
After months of trying to curb the global pandemic, economic relief is the country's next great challenge. Antonian Kalingo says he's financially just about back to where he started 9 years ago.
And we're getting to the point where we're about to expend all the money that we had saved for an emergency fund. So it's going to be back to square one, and we're still not bringing any athletes in to create any revenue.
Diaz says she remains hopeful in a time of great uncertainty by leaning on her coworkers.
Yeah, it's been really great, like having them for their support, because they know exactly, we know what we're going through together.
Rick Bright, the former director of the Biomedical Advanced Research and Development Authority, who was in charge of developing a vaccine for the coronavirus, has filed a whistleblower's complaint. Bright was a high-ranking federal scientist focusing on vaccine development and was Deputy Assistant Secretary with the Department of Health and Human Services. April 20th, Bright claimed he was removed from his position to a, quote, less impactful position at the NIH after he was reluctant to promote certain drugs as cures for the virus, such as hydroxychloroquine, the drug Trump was touting as a good medication to combat the virus. Since then, multiple studies have found the medication not only had no impact on people with the virus, but actually caused heart complications in some users. Bright's complaint alleges government wrongdoing by Supervisor Robert Kadlec, who reports to HHS Secretary Alex Azar, who has been working closely with the task force and Trump throughout the pandemic. Dr. Rick Bright says he stopped receiving a paycheck on April 20th and is still sitting in limbo, not having received any further duties or responsibilities. Coming up next, an internal projection model from the White House and the CDC predicts that by month's end, the U.S. will see the highest amount of deaths and cases per day. Stay with us.
This year, you can complete the census by calling or going online.
Or return your form by mail.
Make your family count!
It only takes 10 minutes to fill out the 2020 census online, over the phone, or by mail.
Currently, the U.S. is seeing about 25,000 cases of coronavirus per day, but a new internal report from the CDC, first reported by the New York Times, projects there will be 200,000 new cases per day by the end of the month and about 3,000 deaths per day in the beginning of June. Here's the catch. By the end of this week, 40 states will have begun reopening, and as we saw in the beginning of the show, people aren't being as conscious of physical distancing as they should be, as seen by these crowded beaches and parks. And the president himself told Fox News on Sunday night that he thinks certain states aren't opening fast enough. And on Wednesday, the president honored nurses in the Oval Office who have been battling the coronavirus pandemic on the front lines. Sophia Thomas, who is the president of the American Association of Nurse Practitioners, discussed her reuse of PPE while on the job. Trump didn't seem to like that.
Back when we went to school, one gown, one mask for one patient a day or per time. This is a different time. And I've been reusing my N95 mask for a few weeks now.
Sporadic for you, but not sporadic for a lot of other people.
Oh, no, I agree, Mr. President.
Because
Absolutely.
I've heard the opposite. I've heard that they are loaded up with gowns now. And, initially we had nothing. We had empty cupboards. We had empty shelves. We had nothing.
Wow, a lot to unpack. First, you're honoring the nurses. Why are they the ones standing behind you while you're sitting down? Maybe show a little respect for their efforts by standing for them. Second, would it hurt to maybe just uncross your arms for a second and look her in the eyes while she's talking about the issues she and her colleagues standing behind you are facing? Maybe for 1 second, if you took a break from worrying about the media's coverage of your performance during the pandemic and worrying about the ratings your press briefings got, maybe you'd have a little more compassion for someone who's put their life on the line all while using the same N95 mask for weeks. By the way, who are you to downplay a nurse's truth? I'm sure she's not lying about reusing the same PPE, and if she's facing those challenges, so are other doctors and nurses. But then again, you're the person who downplayed the very virus that we're talking about for months. So don't claim you have many people who tell you they have all the things they need, when a nurse you are honoring in the Oval Office is telling you otherwise. Anyway, moving on. On Sunday night, Trump gave an updated total of deaths he thinks the U.S. will see when this is all said and done.
We're going to lose anywhere from 75, 80 to 100,000 people. That's a horrible thing.
Just 2 weeks ago, Trump made claims that he believed the U.S. would see 60 to 70,000 lives lost.
We would have had millions of deaths instead of, it looks like we'll be at about a 60,000 mark.
He seems to have changed his mind. Sunday morning, before Trump gave his increased total of 80 to 100,000 lives lost, White House coronavirus coordinator Deborah Birx said the White House hasn't changed their initial projection, which predicts 100,000 to 240,000 deaths. Here's the problem with this. Most of Trump's followers do not trust other politicians. They don't trust what we, the media, tell them. They don't even trust the health officials helping fight the virus. Guess who they do trust? Donald J. Trump, who claims we're on the back end of this virus, even as we still see around 2,000 deaths a day. The same people who've been protesting, yelling without masks, not social distancing, putting others at risk. So you see, even when the president just says whatever he thinks sounds right, thousands of people follow, against the guidance of health officials everywhere. That's the scariest part. Other people's lives are on the line because the president is careless with his words, which then pushes his followers to blindly accept and follow what he says. In other instances, that would be more isolated and less dangerous. But in the case of a highly contagious virus, which people can carry without any signs or any symptoms, other people's lives are on the line. And Trump has yet to be more carefully selective with his words. And if a deadly virus won't do it, if over 75,000 lives lost won't do it for him, then what will? What will? We'll be right back.
As the nation's doctor, I often get asked, what should I do if I think I might have coronavirus?
People who are sick should stay home. You don't go to an emergency room, you don't go to a clinic. You get on the phone and you ask for advice and instructions from your physician.
We don't want you to go into the ER or the doctor's office without talking to them first because you might spread coronavirus to someone else. Please visit coronavirus.gov for more information.
New York is the canary in the coal mine. What happens to New York is going to wind up happening in your city and in your community. We are going to fight every way we can to save every life that we can. We are all first responders. Your actions can either save or endanger a life. Job one has to be save lives. That has to be the priority.
The Walt Disney Company announced Disneyland in Shanghai, China will reopen May 11th. The Shanghai location closed in January, and Disney CEO Bob Chapek said they will enforce social distancing within the park. The park currently has a capacity of 80,000, but the Chinese government said they are limiting attendance to 30% of that capacity. Chapek said guests will be required to wear masks and will have their temperature taken before they enter the park. This coming after Disney announced a 91% decrease in net income in the previous quarter. All other Disney parks remain closed at this time. The White House says President Trump has tested negative for coronavirus despite one of his personal valets becoming infected. Press Secretary Hogan Gidley says the White House medical unit confirmed the positive test. CNN's Caitlin Collins reports on how the White House is responding.
It's a big deal, the Oval Office.
Today, there is the first known case of coronavirus inside the West Wing.
Yeah, it's a little bit strange.
A member of the U.S. Navy who serves as one of President Trump's personal valets has tested positive, upsetting President Trump when he found out and raising concerns about his own possible exposure. The valets are members of an elite military unit assigned to the White House who work incredibly close to the president and the first family.
I've had very little personal contact with this gentleman. Know who he is, good person, but I've had very little contact. Mike has had very little contact with him.
Sources tell CNN the unidentified male exhibited symptoms while on White House grounds this week, though it's unclear when he was last in the Oval Office. In a statement, a White House spokesman told CNN the president and vice president have since tested negative for the virus and they remain in great health.
The president is doing fantastically today, as is the vice president.
Despite CDC guidance issued by his own administration, President Trump has resisted wearing a mask so far by citing how often he and his senior staff are tested. As he hosted medical professionals at the White House yesterday, a reporter pointed out that no one was social distancing or covering their face.
Look, I'm trying to be nice. I'm signing a bill, and you criticize us.
The White House hasn't said whether today's news will change the president's behavior going forward, as one of his top aides deflected.
And I think if anybody should start wearing masks and showing more respect, it should be the media.
According to the Associated Press, Trump has told advisors that wearing a mask would send the wrong message as he focuses on reopening the country. He says he wore one briefly in Arizona this week before later removing it.
I had it on backstage, but they said you didn't need it.
CNN has also learned today that the CDC prepared detailed guidelines for reopening the country, but the White House rejected them and asked for changes. The guidelines put together by health experts offered more details about reopening schools, churches, and restaurants. But an administration official told CNN the White House felt they were overly prescriptive because guidance in rural Tennessee shouldn't be the same as guidance for urban New York City. The press secretary reiterated this week that the White House wants governors to implement their own guidelines.
We have this beautiful concept called federalism, which means that the states lead on this.
So we've seen the struggles the collective American public is going through. A health crisis unlike any we've ever seen before. An economic shutdown that has paralyzed businesses big and small everywhere. We talk a lot about the shortcomings of the President of the United States, and there have been a lot of them. But if we want to be productive, we have to talk about what needs to be done to heal this country. The President needs to first stop blaming people and accept his faults. Everyone has them. If he can admit to his errors and begin healing the country with empathy and compassion, we can get on the right track. He needs to also stand in unity with frontline workers and public health officials, not directly contradict them in the Oval Office or retweet things calling for the firing of his head expert. Stand behind them. And then, the President needs to rally the general public around our founding fathers' ideals. People need to be reminded what America stands for and where we belong. We all want life. We all want liberty. We all want the pursuit of happiness. We need to work together to achieve that. Because a house divided against itself cannot stand. Good night. Stay safe.